Welcome to the Mastermind session. My name is Dr. Danica Bowen, and I'm the Senior Director of Higher Education and Global Partnerships at Chamberlain University. Today, our topic of discussion is why is interprofessional education important in the health sciences? Interprofessional education refers to occasions when students from two or more professions in health and student and social services learn interactively together for the explicit purpose of improving interprofessional collaboration for the well-being and health of our patients and clients. Dr. Maureen Hall, Associate Professor of Medicine Academy for Teaching and Learning at Ross University School of Medicine, and Ms. Lisa Pagnotti, Simulation Manager at Ross University School of Medicine, will serve as our panelists as we discuss this important topic. As part of the discussion, we will be introducing interprofessional education, discussing the importance, the challenges, as well as the implementation. Let's take a couple of minutes to meet our panelists. Dr. Maureen Hall has been affiliated with Ross University School of Medicine since September 2009, primarily in the role of certified academic coach, facilitator, author, physician, and educational scientist with the expertise in lifelong learning and medical simulation. Her work particularly involves small group teaching in both the basic and clinical sciences, including metacognitive skills training of students, test-taking strategies, and individual student learning assessments to establish academic learning milestones. Given her philosophical approach to academic performance, she loves to collaborate with her colleagues to steer qualitative research on students' expedition to success. In June of 2018, she was named the Heart of RUSM, Ross University School of Medicine, by the Student Government Association. Dr. Hall has been licensed by the state of Connecticut with certification of registration by the Bahamas Medical Council and the Dominican Medical Board. She obtained her Doctor of Medicine degree from St. George University School of Medicine in Granada. She completed her undergraduate degree in psychology at Nova Southeastern University in South Florida. She has particular interest and research in hyperbaric medicine, lifelong learning principles, and complementary alternative medicine. She is a member of the American Academy of Family Physicians, International Hyperbaric Society, and the Association of the American Physicians and Surgeons. Welcome, Dr. Hall. Our next panelist is Ms. Lisa Pagnotti, and she is currently the Simulation Manager for Ross University School of Medicine in the Clinical Sciences Department. She has earned a BS in Health Education, an MS in Physician Assistant Studies, and a Certificate of Advanced Graduate Studies in Health Professions Education. She's currently a PhD student in Translational Health Sciences at George Washington University. Lisa's been working in healthcare simulation education since 2011. In this role, she developed and implemented simulation curriculum, facilitates and debriefs simulations for medical students, medical residents, and nursing students. She was trained in interprofessional education through the Interprofessional Education Collaborative Faculty Development Institute and has been involved in IPE curriculum development across the Adtalem Global Education Health Profession Schools. So we have two wonderful panelists today to start this discussion. So let's just start at the basic level. And I'd like to start with you, Dr. Hall. What is interprofessional education?
Interprofessional education has actually two schools of thoughts. One being the traditional IPE, which is again interprofessional education, and the other the novel interprofessional education. But just for some background, the idea of this came from the idea that teams should be collaboratively practicing to improve health care around, and this started like around about 50 years ago. So during that time, many experiments with a variety of approaches for educating health professionals took place, and professionals at that point worked in teams. Interest in this topic was renewed after the Institute of Medicine issued a series of reports, this is back in the early 2000s, that raised concerns about medical errors and patient safety and the quality of healthcare delivered in the United States. And today, global leaders recognize the need for health professionals to work together in a team-based and a collaborative healthcare setting. And starting with the medical students first, and then continuing into the professional settings, to ensure that there are two major things that were met. and I refer to them first as the patient to obtain the highest quality of care, and then price to lower cost in all settings. There are two different names, as I mentioned, interprofessional education, IPE, and then there's a new one that refers to interprofessional practice and education. The phrase interprofessional practice and education is a way to create a shared space, more interprofessional education, interprofessional practice, and collaborative practice. The new IPE does not replace principles that are related to these concepts, but rather it embraces them. The new IP is not education or just for education's sake. It is about the people, our patients. It is about improving health. It's about creating support systems and trying different models of practice. It intentionally supports people, including health professionals, healthcare workers, students, residents, patients, families, and communities to learn together every day to enhance collaboration and improve health outcomes while reducing costs.
Thank you, Dr. Holland. Different ways to refer to this topic. You know, you hear IPE, you hear interprofessional education, you hear practice brought in there. So it helps to have a little bit of clarity in that area. Ms. Pagnotti, what are your thoughts in this area? How would you define interprofessional education?
Well, I think that was a really great introduction. What I would add is just talking about the Interprofessional Education Collaborative, and the acronym for that is IPEC, and you might hear us refer to that throughout this conversation. So back in 2011, IPEC produced a document that were 4 competencies for interprofessional education. Those competencies include teamwork, communication skills, roles and responsibilities, and the 4th one is ethics and values. And of course, those are all under interprofessional education. So most professions have that for their own profession, but these are really focused on that interaction between professions.
And Ms. Pagnotti, let's stay with you. Why is this important? Why is that worth our time to be discussing this morning?
Yeah, so I think it's really important for our...
Sorry, I should clarify.
Yeah, no, I think this is really important for our health science students. We know, as Dr. Hall mentioned, that interprofessional teams, they're more effective, they're more efficient. Patients are actually more satisfied because they have better coordinated care, and it's more cost effective for our healthcare system. So I think there's many reasons why it's important to talk about it and take the time to invest in this type of initiative. We really need to train our students in the same way that they'll practice. You can think about it in the health or in the sports analogy. We would never think of training each basketball player by themselves and then putting them together on the court to go and perform in a game. And the same is true for our healthcare workers. We need to train them together. We really need to learn and practice together in order to achieve those best patient outcomes.
I really like that. When you start breaking it down to the sports, it makes a whole lot of sense. I know when you're looking at this in terms of the different settings, this is something that is gaining more and more momentum about the importance of it. So people are able to really collaboratively work together and essentially even have a better approach. Dr. Hall, what are your thoughts on this topic? Why is this?
Okay, yeah, I have 3 thoughts that come to mind in terms of how this is important for the health science faculty, and I would like to add even the stakeholders. So when we think of the faculty serves as educators, teachers, and role models for our students, as Lisa explained. But when health science faculty models the appropriate attitude towards the IPE, students are more likely to follow by example. So faculty can nurture the development of the proper attitudes towards interprofessional practice and education by teaching our students and leading them by example. Interprofessional learning is the second one that I want to talk about. Because it can positively influence attitudes toward other professionals and improve teamwork skills, particularly when introduced earlier on in the curriculum. And this is something that can easily be taught and in several ways, such as IPE. And when we think about it, it's not just even students, it's even from our patients. When we think in a clinical setting, our students, education, and also the faculty development. And most of all, we need to get buy-in from stakeholders, not only from the faculty, but faculties as leaders and educators, but also those stakeholders that are providing the funding so that we can build a learning environment that is conducive for teaching students with, about the interprofessional education. Buy-in from stakeholders and faculty will more likely support the works of implementing interprofessional education into the curriculum, starting first with our students.
Wonderful point. You brought up some of the wonderful aspects of it. Let's kind of flip it over a little bit. What are some of the challenges in developing and implementing an IPE curriculum? And let's start with Ms. Pagnotti on that one.
Sure, this is a great question because there are actually so many challenges that we could talk about, but I'll just name a few. The first one that comes to mind is scheduling. So it can be very difficult to schedule the learners to come together at the same time. Each profession has their own schedule. They might be in clinicals that day, they might be in the classroom. So it can be very challenging to get everyone together at the same time. So that usually proves to be one of the biggest challenges. Another challenge is the level of the learner. So this is something to really think about ahead of time. Because if we have nursing students, they're learning usually clinical information right away in their curriculum. But for our medical students, typically they've been trained in more of the sciences for the first couple of years, and then they get more into clinical in their third and fourth years. So it's possible that when you're putting some groups together, put a first year nursing student with maybe a third or fourth year medical student. And that would actually be a better match of which level they're at within their curriculum. So it's very important to think about where they are within their own studies. I think the next thing is the number of learners per group. So if you're putting together, typically these are going to be kind of a small group session, as we talked about. You really want the learners to learn with and from and about each other, in something that's interactive. So a lot of times it's going to be your active learning in your smaller groups. So thinking about that group size, for us, just as an example, we have a lot of nursing students. So we may have 500 nursing students, but in our social work program, we have 50. So you really want to think about how are we going to, match these people up. We don't necessarily want 5, nursing students with 1 social work student because there can be, a power differential there, and it may come across as this is more focused on nursing. So it's really important in IPE to try to kind of level that playing field and get those more even groups. And so you might need to be a little bit creative about how to do that depending on what number of learners you have in each profession. The other thing I would say is just competing priorities. This is both for students and faculty. We know everyone has a really busy schedule, and it's difficult to find the time to be able to come together and plan this or to implement it all the way along the spectrum of working on this kind of new initiative. And also, I think along with that is just the faculty development, as Dr. Hull was talking about. It's, the faculty right now aren't necessarily specifically trained in interprofessional education. It's not something that comes naturally. It's not something that we learn just through practice. It's really something that we need to be taught and we need to think about. I think one good example is even some of the terminology that we use, because each profession really has their own vocabulary that they use, but sometimes that doesn't come across well across the different professions. And so sometimes it's just learning to use terms that are more inclusive of other professions, which can make a big difference. So that's just to name a few that are off the top of my head here.
Well, and it's interesting you brought up some of the language uses of it, right? So if there's different training at the physicians with the nurses, and then everybody needs to be speaking that same language when they're doing the patient care. Let me turn it over to Dr. Hall to see if the additional challenges that you can think of and maybe some tips as how to overcome those challenges.
Okay. Yes, as Lisa mentioned, there are many tips, and you can understand why because we have over 140 institutions within the United States alone that have implemented the interprofessional education curriculum. And but I will share my top three. And this really goes back to, again, what Lisa mentioned, training the trainer. And I would like to add is that it's not enough just to continue training the providers in silo or separately. We need more interactive or innovative approaches to changing or to this challenge existing attitudes, and to improve interprofessional relationships that will promote favorable outcomes for our patients. And again, this is all about our patients, helping people in the communities. And this is in a way, by practicing together as health professionals, we can reduce medical errors, we can reduce hospital stays, we can reduce infections, and thereby increasing the quality of patient care. The other thing is just providing faculty development funding. Invest in getting faculty development programs for educators. And I can think of two memberships that will be helpful to overcome, to educate further educate our health professionals. And that will be the National Center for the Interprofessional Practice in Education. And this center was founded with the support from Josiah Macy Jr. Foundation and the Robert Wood Johnson Foundation, the Gordon and Betty Moore Foundations, United States Health and Human Services Health Resources and Services Administration, and the University of Minnesota. I remember when I was doing my training, I went to University of Minnesota to learn more about how interprofessional education helps with patient safety. And they had a robust program that was developed. And there we worked with not just the medical students, we also worked with pharmacy students. There was also work done with nurses, as Lisa mentioned, as well as the EMTs and other health professionals. One more thing I would like to emphasize is that the working in partnership. That is the key. Collaboration, collaboration, collaboration. That's very important. For schools that have multiple health students or cohabitating in one campus. For instance, they have medical, dental students, it's easier to implement that program. But with those who have just a silo or uniprofessional educational curriculum, there may be a challenge. And one way to overcome this is through collaboration and working in partnership. I would like to share another story. There was one earlier this year. There was a director for one of the pharmacy university who was actually sending out invitation to invite other programs to join their IPE curriculum. And that way, even though the school was an actual separately training pharmacists to become pharmacists, but the problem was they realized the importance of interprofessional education. And even though they didn't have the luxury of other professionals in their campus, they sent out invitation. And that's the idea of overcoming this problem of implementing IPE in a curriculum. So the key thing is work in partnership, collaborate.
Wonderful. And let's talk a little bit about some of the work that's being done at Ross University School of Medicine. How is the school handling IPE? Let me start with Ms. Pagnotti.
Sure. Yeah, I think I'd like to add just a couple practical tips before I go into what we've been doing. And it kind of ties right into it, actually. So one of them is, if you're looking to get started with an IPE curriculum, is just to start small. I think sometimes we kind of think of it as this kind of big monster, and it ends up being a big project. But I think if you just start small, you can do one session, you can pilot test it, you can get some feedback. I think that's really the best way to get started. As Dr. Hall's been saying, we really want to engage the stakeholders. So that's not just the faculty, but the students as well. If you can get some students who can participate in creating it, or if not, at least really get their feedback on that pilot testing. I think for us that was really important to see what was important to them in terms of this initiative. So that was helpful. The second practical tip I wanted to say is there's a resource out there that's called MedEd Portal, and you can just Google that, and they have an interprofessional education section. So I think it's really good to take a look and see what's already out there. Definitely you don't have to start from scratch. There's lots of people, as Dr. Hall mentioned, 140 schools that have already implemented curriculum. So you can see what's already happening out there, what they're using, and then how you can adapt that to your local context. So that kind of leads into what we're doing at Ross University, because we used those tips, of course, that were helpful for us. So we started with a very small in-person, it was a voluntary event between just nursing and medicine initially. And it was a simulated experience with a standardized patient. And so we ran it and received feedback, and then we were able to improve that process. And from there, we wanted to build upon that to include other professions. So we're lucky here at Salem Global Education. We have many schools. We have medicine, we have nursing, we have social work, we have public health, and we have healthcare administration. So we really wanted to include all of them in our initiative. So from there, we built an interprofessional education council, which helped us to have dedicated time and resources to this project. And from there, we were tasked with creating a 6-week interprofessional education course, which includes reading and lecture, some live discussions, and some videos. And so those were based on those IPEC competencies that I mentioned earlier. So each module kind of follows one of those, whether it's teamwork, communication, roles and responsibilities, and then values and ethics. And it was really exciting as we, took a long time to put it together. As we said, we had to overcome a lot of those challenges and barriers that we already talked about, but it is doable. And it was really exciting to see it come together. And now we're kind of moving into the implementation phase. So that's where we're at.
Wonderful. Dr. Hall, anything to add in that area in terms of your experience at Ross University School of Medicine?
Yes, being a part of one of the pioneers that helped to develop the medical simulation program, yes, we do find that nursing students and medical students were the first part where we first implemented using this approach to learning. I think it's very important to help to level out the hierarchy that we tend to see when you talk about doctor and the nurses and the teams that are working together to help the patient and to provide appropriate patient care. So I feel that Ross, we have come a long way, and being able to implement this type of interprofessional practice and education, it's great. And I like what Lisa mentioned, that even though because we're under the umbrella of a larger institution that has many other programs, it is good to see that we're collaborating together and starting again from the level of the student to teach them the importance of how attitude helps as well with patient care and help to provide the best quality of care for our patients that we will have to take care of. So that is great.
Wonderful. Based on all of this, it sounds like we've clearly set the stage of why IPE is important. So why does a shortage of IPE exist within healthcare curriculums? Let's start with Ms. Pagnotti, and then I'll turn it over to Dr. Hall.
Sure. Yeah, I have a couple thoughts on this. I think first it kind of harkens back to the challenges. It really is difficult. I don't want to overlook that. It is challenging to put it together because you have to involve so many people. And so it just comes up with some, challenges that we talked about earlier. So I think that's difficult, but definitely ways to overcome that. We also have a bit of historical momentum, I feel like, in healthcare education. So whatever we've been doing, we like to keep doing that. And, instead of trying new topics or new techniques. So I think that that's also a challenge for us. And many healthcare curriculums are really packed with required elements. So one thing that I think is really helping this interprofessional education initiative move forward in many schools is that most of the health professions now, their accrediting bodies are requiring some kind of interprofessional education curriculum. So that's really giving us some momentum there and some purpose and reason why we're trying to implement this. So I think that's definitely helpful in terms of getting the right resources on board to move this forward. But on a positive note, many schools have already done it, and we're getting there as not just our institution, but as a country. So it's just taking a little bit of time, but we're definitely moving in the right direction.
Absolutely.
Yeah, thank you for that. And Dr. Hull, what are your thoughts? Why is there a shortage?
Okay, my thoughts really goes back to research. As you know, that's my passion. Mm-hmm. So when I think about that, I would think about what research studies would I probably can suggest that educators could use to examine to gain more insights about IPE. And with that, with being more knowledgeable about IPE, we'll have more traction towards that and to development.
It's interesting you brought up the research component of it, because I know that there's a number of different studies that have been out there reinforcing the importance of IPE within the classrooms as we continue to move forward. Are there any particular research studies that you would suggest that educators examine to gain insights into IPE?
Yes, I've done some research of the literature, and I was not surprised to see that there was a myriad of research information on the notion of IPE. But yet still, what was fascinating is that it was only recently that IPE gained a momentum in some of the political as well as academic momentum in the US, and the UK, even Japan, even Australia. I've seen some of these studies. But what I would recommend, though, for educators, first, I would suggest educators not only scrutinize the literature to gain insights into the IPE for implementation, but rather to analyze research studies that emphasize the barriers. What are the barriers to implementation and how do you overcome them? This will provide the insight for solutions, and the challenges will be discovered and resolved. The other thing is that given that there is a positive evidence in the literature demonstrating that since this implementation of interprofessional education has been in collaboration and practice as a result of IPE and interventions, we want to know, the educator should focus on the research themes based on the efficacy or the effectiveness. What are the effective things have happened since these implementation? So that's an area that should be more motivating for institutions to implement an IPE. IPE intervention has proved to be challenging, as we've mentioned, but most interestingly, there are no studies yet that have been able to reach or achieve the Cochrane criteria for systematic reviews. And it is hoped that with further collaboration, whether that's international, whether that's within a program that has various other health professionals that they're able to implement this, educators can begin to examine or even develop their own research studies to demonstrate the positive impact, especially as it relates to patient safety and patient education, that will improve outcomes as a direct result of implementing interprofessional education. Finally, I want to also mention too that research, when faculty, in terms of looking at studies or educators are looking at studies, again, it's good to get a peer-reviewed study to select that research study. Look at things that perhaps were in the last 6 months or even to a year. And then again, look at the subject in terms of, like I mentioned earlier, interprofessional education as well as interprofessional education and practice. Investigational studies that emphasize ways to evaluate the effectiveness of the IPE intervention is important. And given the pandemic of COVID-19, while the field of interprofessional education may be leading the curve of focusing on communication and collaboration, there are further steps that needs to be taken to embrace critical thinking and creativity, and that which may be necessary to help us understand more about the differences for the in-person versus the virtual. Because now with the pandemic, where a lot of the work that we did was now transferred. They were all now transferred to a virtual setting. So the virtual interaction among students and other members of the health professional teams, this is an area that educators should examine to further describe how these concepts should be developed in future online or in-person educational and practice experiences.
Thank you. I'm going to be our last question. We're coming up on our time, and it's actually probably the most important one. Is it working? Does what we teach our students, is it translating into practice from your perspective? And let's start with Ms. Pagnotti, and then we'll go to Dr. Hall.
Yeah, that's such a great question. And especially as a PhD student in translational health sciences, it's near and dear to my heart. So yeah, we always want to know as educators, is what we're doing making a difference? And I think that's really where the research needs to move to. I think initially, a lot of the research in interprofessional education, just like in other fields, it starts out by asking questions about students' attitudes, perceptions, even satisfaction. We kind of start with that level. But now we know, most students really enjoy it. They learn a lot from it. And they do change their attitudes throughout their interprofessional education training. So all of those are really positive outcomes we've seen. But now, yeah, it's harder to measure. Is this really impacting, practice and patient care? As we said earlier, what we know is in practice, it does. So for those healthcare teams who work together and who train together and who improve their communication skills, their teamwork skills, they have a shared vision and mutual respect among their teams. They are more effective. They are more efficient. Their patients are more satisfied, and the cost is less. So we know that piece. To link what we're doing in the education side of things for our health professions learners and seeing, is that making a difference in practice? And like I said, that's very hard to design a study around, but I think that's really where we need to, move to. So there's an opportunity for anyone out there looking for some interprofessional education research.
Perfect segue. Dr. Hall, please take us home. What are your thoughts? Is it working?
Yes, I agree. It is working. We start with our students, as we mentioned earlier, and the students are so resilient. They are so eager to learn and how to help and support patients. It's about supporting patients, family, and also the community. I'll share a story when we had, when I was first introduced to this, was doing my training, and there was a problem where we had a lot of infections at our hospital, and we all got together. That's nurses, that's pharmacists, those were the medical students, residents, and the attending physicians. We figured out how could we reduce the rates of infections. And we came up together with an idea of what we can do, how to make sure everybody from their vantage point was able to see a piece of work that they can implement that will help to reduce this likelihood of infection. And our studies, our tests, our lab results showed that it worked. Patients were less likely getting infections. And the rate of the infections for those patients and this was in the ICU, by the way, had significantly reduced. So my answer is a resounding yes. Of course it works. And we are motivated. And that's what motivates us and drives the force and to increase the energy towards interprofessional education. And I am excited about it. And I'm encouraged to work more towards this goal.
Thank you, Dr. Hall. And with that, I would like to thank our two panelists, Ms. Lisa Pagnotti, as well as Dr. Maureen Hall, for your time today. I'd also like to thank the viewers for watching this mastermind session, as well as encourage everybody to attend our next mastermind session, which is scheduled for next Wednesday at 1 p.m. Central. Please join us on the Chamberlain Facebook, as well as the LinkedIn page. With that, I wish everybody a wonderful week, and please stay safe. Thank you for your time.